Today we're talking about Hydrosalpinx. Above me here you're going to see a representation of a normal uterus and uterine tubes. Despite this looking like it's attached, there's actually room between the ovary and the end of the uterine tube here. So there's a bit of fluid exchange with the peritoneum, your abdominal cavity. Down here you're going to see Hydrosalpinx. This is where one of the uterine tubes has become blocked. Once it's blocked, the fluid can no longer go in and out, and it starts to build up and swell inside the uterine tube. This can present with no pain at all, despite looking terrible. However, it can cause pain. It can have symptoms like PID, pelvic inflammatory disease, where you have fullness, pain, maybe sort of mysterious sensations through your abdomen. This swelling has major effects on fertility. Primarily, it can cause the egg to not be able to get down into the uterine tube. And because sperm are itty bitty like this right here, they can actually still get through there, so it increases your chances of ectopic pregnancy. If the swelling's really severe, even sperm might not be able to get through. This is what Hydrosalpinx looks like on an ultrasound. This is actually a barium study, so they insert this tube here, and then they inject barium, radioactive dye, into the uterus to see if the tube is actually blocked. Because like I said, what should happen is that it will actually fill up this entire area. There will be leakage out of the uterine tube because remember, they're not connected to the ovary. Behind me, I have an image of this that might be, you might want to swipe, you might not. I added the googly eyes thinking that would make it, more palatable, but I think it actually made it worse. Just in case you don't know, that's the uterus. And just so you know, this is a pretty extreme example of this. So on a whole, this is relatively uncommon. But if you're having problems with infertility, it's much more likely that you're going to see Hydrosalpinx. The numero uno cause of this is an untreated STI like gonorrhea or chlamydia. Make sure they wrap it up before they slap it up. If you're one of the 1 in 10 women who experience endometriosis, it's important to realize that you also are at higher risk for this. There is no natural treatment for this, so do not let people lighten your wallet with fake promises. There's basically two options. They can try and repair the tube. That is not preferred. Or number 2, they go in and they take the tubes out. If they can confirm that it's only minor damage, they may try the repair first. Hydrosalpinx can affect one or both tubes, and that's going to play into the treatment and the parts about fertility. As always, thanks for learning with me, and if you have a question, you know what to do.